The following program is a special presentation of KTIV News 4.
I didn't go to the grocery store because it was painful.
Tonight, we're taking a closer look at the medical and surgical options available for weight loss and the not-so-obvious challenges that can come with those options.
We want to make sure that a patient is not only physically healthy and ready to go through the surgery, but that they're also mentally ready.
From the patients who underwent weight loss surgery, to a surgeon performing the procedures, and the nurses and clinicians who offer support and guidance. We have our panel of experts from CNOS here live to answer all your questions. Now, Shifting the Scale, a KTIV News 4 special. Here are your hosts, Matt Breen and Jessica Bowman.
Good evening, everyone. Thanks for joining us tonight for the special presentation, Shifting the Scale.
That's right. And over the next half hour, we'll explore the issue of weight loss surgery, including how to determine if you're a candidate for it, possible non-surgical alternatives, and both the surgery and recovery process.
We are joined in-house by a panel of experts from CNOS. Dr. Jim Hegvik, a general surgeon who specializes in weight loss surgery, and the members of his team, Brenda Von Skoik, a physician assistant, Megan Cleveland, a registered dietitian, and Angela Swartus, a registered nurse at CNOS.
And on top of all our questions, we're answering your questions as well tonight throughout the entire show and continuing afterwards on our News 4 Now streaming app. All you have to do is send them to us right now via social media, and we'll try and get you an answer.
We're going to start tonight with a question for Dr. Hegvik. Dr. Hegvik, what are the most common types of bariatric surgery? How do they differ in terms of the procedure and the results? And more specifically, what are the two procedures offered at CNOS?
So the most common types are the sleeve gastrectomy and the gastric bypass. The results are very similar. Maybe a little bit more weight loss with the gastric bypass and a little more help with reflux control. And those are the two that we offer here at CNOS.
And what's the time difference in performing the two surgeries?
So length of time for this, yeah. So they both take about under 2 hours. The sleeve is about 30 to 45 minutes. The bypass, usually about 2 hours.
Okay. Now, what are the general eligibility criteria, kind of the requirements for someone who's considering bariatric surgery?
So when we talk about that, I talk with my patients that BMIs between 35 and 40 usually have to have a medically treated comorbid condition. So what that means is something like high blood pressure, high cholesterol, maybe sleep apnea, something that their doctor is seeing them for that's related to their weight or the obesity. Usually if you have a BMI of over 40, you don't have to have a treated condition, and that can usually get us qualified.
All right, Dr. Hegvik, thank you.
All right, this question tonight for Angela. Can bariatric surgery help with conditions other than weight loss, such as diabetes or maybe hypertension?
Yes, several of them, they can be treated and helped. Sleep apnea is a big one. Heart conditions, kidney failure, diabetes, a lot of the big major ones they can help with.
All right, Angela, thank you.
Dr. Hegvik, we talked about the criteria, sort of the requirements for people qualifying for bariatric surgery. How does a patient's mental and emotional health play a role in whether or not they're a good candidate?
That's an important thing that we look at a lot. And it's something that every patient that goes through weight loss surgery does have to have a psychiatric evaluation or with a psychologist. And we look at that, and I talk with them a lot about making sure to involve their significant other, their primary care provider, their mental health providers with that, so that they're involved with them post-op as well.
Thank you.
And another question tonight for Dr. Hegvik. Let's get straight to this question. What are some of the potential risks or complications associated with bariatric surgery?
So the biggest things that we talk about are some of the major ones would be a leak. Anytime we divide the intestine, that's something that can happen, or you can bleed from that location, or it could kink or narrow. Other things that we can deal with, and those are really uncommon things. The most common thing would be nausea, constipation, things that we can manage, and we're really used to managing in the office.
Okay. Now, here's a question from one of our viewers, and if you want to send in a question, you certainly can. Just send it to connect@ktiv.com. Now, Brenda is asking, what weight loss medication do you recommend for someone who's struggling to keep the weight off post-weight loss surgery? Dr. Hegvik, what are the medications that are out there?
So the most common thing that we see now is going to be the GLP-1 medications. We see those a lot. They've become really popular, obviously, Ozempic and Wegovy, and they do help us. I think if people have troubles, with weight regain after surgery, they can always come in to see us. And the main thing is that we want to get them back on track. We want to see them, see how they're doing. What are their complaints? Where are they struggling? We have a dietitian that can help us in the office, and she does a wonderful job with that. And then if we determine that medication is something that we can do, I would say semaglutide is something that we use a lot of. and they can help.
Thank you, doctor.
And if you have a question for our panel, all you have to do is send it on over right now to connect@ktiv.com, and we'll try and get you an answer before the end of the show.
Time to take a break, but we have lots more from our panel coming up.
That's right. In the next segment, we're going to look at alternatives to surgery and the process itself. Shifting the Scale returns in 1 minute.